All right, so here is my list of questions. And my first one is, what is your name and where do you work?
My name is Leilani Kruger, and I'm a registered nurse at the Iberia Heart Hospital in Sioux Falls, South Dakota.
What does your job entail?
I work some of my shifts as the assistant director of the PCU, the patient care unit, which takes care of patients after procedures. And some of my shifts I do house supervisor, where I charge nurse on those days.
All right. And what do you do as a charge nurse?
We place patients after procedures. We keep track of who's coming and going, manage staff, really delegate patients to which staff can take care of those patients, be it critical care patients versus telemetry patients, which aren't quite so high acuity and high needs.
Is there any need for upper management currently in your work?
Actually, right now we are seeing some changes where some people that have been in positions for quite a while are starting to retire. So there is openings. So there's the nurses, and then there's directors, director of nursing, and then even people above them, managers above that. So like the president, the chief operating officer, other nurse managers above the director of nursing too.
Is there any positions where I wouldn't need to have a medical degree, like such as a manager or an HR person?
Yeah, HR wouldn't have a medical degree. And then there's the other, like the chief financial officer and operating officer. They don't have any medical degrees.
How often are there openings for HR and the upper management?
I've been there 17 years now, so there's been two. I think we're on our third HR manager now, so not terribly often. And then like I said, there wasn't a lot of openings for a while, but now the people that opened the place 23 years ago are now starting to retire. So there's a little movement with upper management.
And how would you say your overall work environment is?
We're a smaller group as far as hospitals go. We're 55 bed unit on the second floor of the patient care unit. So we have a small group of people that work together. So we try to work together well. You have to help each other out to get through the busy shifts. So there's a good cohesiveness and a group of people that work well together and get along well together to get the job done for the same goal of good patient care and experiences.
And then would there be frequent communication between the workers and the upper management and patients, or do not all of them communicate throughout?
I think there's a lot of communication. I'm assistant when I do my assistant director job. I round and say hi to the patients, especially if I've maybe helped get them prepared for a procedure or have been some part of their stay. I'm just kind of touching base with them and seeing how their procedures have gone, how they're calling their family members by name, trying to memorize that to create some not cohesive, but rapport with them. What was the other part of the question?
Would upper management ever communicate with patients, or is that not a...
And our previous director, our president, John Soderholm, would make it a point to see all the patients and bring cookies to the waiting room. So he especially was fantastic to work under and kind of set the tone for everybody that worked under him to not be above anybody else. He would never introduce himself as the president of the hospital. He was just this nice little man who was delivering cookies. But then he got real answers when he asked questions too, because people weren't intimidated by a kind man that didn't announce himself as the president of the company. So I think there's a lot of managers, managers above me and above the director of nursing. There's two that are nurses that are in the upper management, and they do check every day with us. They sit in on a group huddle at 3:30 every afternoon to make sure what does staffing look like the next day. what are the issues that we're having with patients, if there's anything they can help with. So I think there's a good support.
So my class deals with intrapersonal communication, which is people communicating with each other, which you just explained. But then the other part of that is intrapersonal or interpersonal communication, which is yourself. So if you feel like a need isn't being met, are you able to open up about that and explain that what's going on like needs to happen?
I think I being more of a manager job, I hear more of that. I can talk to my boss, but I try not to relay like your frustrations to people that I'm overseeing. So they come to me with issues. We have some stressful patients, and we try to talk through things and figure out ways to manage the frustrations or the fears or the irritations. And then if I feel anything, then I don't talk, then I go to my boss and kind of vent to him a little bit. So I try to kind of absorb it, and get through that with the nurses, and the nurses' aides, and try to help them figure out ways to handle situations, without giving my issues to them, because I'm supposed to be their leader. So or their boss and someone they look up to. So I try to kind of be a therapist and troubleshooter for everybody most days.
So when things like that happen, do changes also happen, or are they not happening? Like, are they happening more than they aren't happening, the changes?
If there's issues, we do try to address it. There's always, when there's a lot of there's staff that work together, there's always issues with some people not working well together. So we try to take that to a head, have meetings with them in the office, to find out the root problem of it. Is it what's the root problem though these two people can't seem to work well together or help each other out or whatever. So we do try to stay ahead of that and find the root problem of it, in depth, because we need to have a team where everybody feels supported.
What should I know before I apply to Avera?
I think it's a good place to work. Depends on what job you'd want to do. If it was medical based versus office based, like nurses can be hands-on, or they can be nurses that review charts. So that there's a lot of opportunity just for somebody that goes to get their nursing degree. Avera has more of a mission-based approach versus business approach, is what I've always felt. Even though the hospital is not for profit, you try to care for everybody, regardless of their insurance or financial status. So it's a mission-based and based on a Christian value, thoughts or mission.
And then why should I want to work at Avera? As a business admin, by the way, like in the business aspect.
I think there's a lot. I think, even though I say it's mission-based, it is still a business, and it has to have good business decisions to be a successful business. And it is. It's expanding. Avera is. So I think there's a lot of opportunities on the business sense of a hospital, because hospitals are a big business, and there's a lot of money that goes through hospitals. So and there's always changes going on with the business side of a hospital, and goals and outreach and expansion. So I think there's a lot of opportunities for business administration, and versus HR is a huge. I think is it Avera or Sanford are the biggest employers in the state of South Dakota. So of course there's huge numbers of departments that are solely HR and management that don't do anything with patients on that end. But as far as the business and just how many employees there are, it is one of the, say, if not the biggest business, it's the second to biggest business in South Dakota for employees.
So then based on all that information, would this be a reasonable target for me to aim for in my occupational area?
I think so. I think they, like I said, not only turn around with retirement, but yet more jobs just opening up based on the size of how big Avera is. I think there's always going to be opportunities for employment in the business area of Avera McKinnon.
So you talked about retirement. What does that retirement plan kind of look like for people who do work within Avera?
I think a lot of people that I work with are lifers, so they came from Vera McKinnon to the Vera Heart Hospital when it opened. So they've been there most of their career, and have been happy there, and then just retire because they are retirement age and they've worked hard. And it's when you work in a hospital, you see what if somebody, you see people all the time who don't quite retire before they have a catastrophic event. So maybe they're more inclined to retire at retirement age, just to enjoy life because you know how short it can be.
All right. Well, thank you for your interview. I think we met our time, so